It's been a long, long time since we've had an episode. But today is where it gets big. We have a special guest, Dr. Ikenna Okereke, who graduated from Johns Hopkins and studied medicine at Washington University. And he's a board certified thoracic surgeon at Henry Ford Health. Actually, he gives back to his community as well. He created this high school surgical mentorship. How about we start the conversation with you telling us a little bit about the program for other high schoolers out there.
Yeah, great. Yeah, thanks for having me. So about 10 years ago in 2016, I started this high school mentorship program. It has three phases. Phase one, I go out to speak to various high schools about my life, obstacles faced, the road it takes to go from high school to where I am now. Phase two, and you participated in that, about 16 Saturdays a year, students come onto our campus and they talk to medical students and residents about life in medicine. They do surgical simulation. We have a cadaver extremity, which you can learn how to sew and expose tendons, vessels, etc. And then we usually go on a tour of the hospital. And during that time, we talk about different medical programs which are available, like BSMD combined programs, scholarship opportunities, and just good networking opportunities. And then phase three is a summer internship. Anyone who is selected is paid $1,000, and they're paired one-on-one with a mentor based on their career interests.
Mm-hmm. That's honestly great to hear. And once I heard of the program, I was, piqued and like I decided to join. And if other high schoolers that are watching this podcast want to know more about it, I'll link it in the description of the video. So let's go more into thoracic surgery. So since you are a thoracic surgeon, what do you do anyway?
So as a cardiothoracic surgeon, most of us do either cardiac, which is heart surgery, or thoracic, which is everything but the heart and the chest. I tend to do thoracic surgery. So most of my patients have lung cancer or esophageal cancer, but then we also do a lot of benign corrective disease or corrective malformations as well.
Can you explain what benign means for some viewers who
So
don't know?
patients either have cancer or they don't have cancer, and it generally falls into benign, so non-cancerous in general.
Okay. All right then. So since we're talking about cases that you have, like now I'm curious, like what is the specific age range that you usually treat? And have you ever had, teenagers come to you and like are most of your cases from lifestyle, like let's say vaping or smoking, or are they genetic? Like,
Yeah, good question. So lung cancer, the biggest risk factor is smoking. There are other risk factors. We've shown environmental exposures can be a major risk, especially here in the Detroit Wayne County area. So most of the time it takes significant amount of exposure, but probably less than we think. But the point is that age is also a risk factor for development of cancer, as it makes sense, probably makes sense intuitively. So most of my patients tend to be a bit older. Maybe the average age is 65 or so,
65.
ranging from 50 to 80. There are patients who are younger, who either have benign disease, so non-cancer conditions, or some patients who have cancer and they just develop it at a very young age. And then most patients who are under 18 generally are treated by pediatric surgeons. That being said, I have operated on infants, I've operated on teenagers quite often with cancer, and then also with non-cancer conditions.
So you mentioned smoking as one of the like being a big risk factor for cancers. Um and with vapes becoming a lot more common in our generation, do they also lead to cancers or do they
Yes,
okay.
and vaping is very dangerous, unfortunately, because there's a false sense of security. Usually, when I go to high schools, I try to preach about smoking cessation. So I'll ask everyone, okay, you don't have to out yourselves, but how many of you know someone who vapes or smokes? Everyone raises their hands. I see kids vaping or young people vaping all the time. It's very discouraging, and unfortunately, they're setting themselves up for damage to their lungs and then eventual cancer.
Can you explain or can you just like state a bunch of other than cancer, medical conditions that can happen to someone that ends up smoking or vaping a lot, especially at a young age?
I had a 33-year-old who died after just 6 months of vaping. Unfortunately, we don't know what's in the mixtures in many of the vaping because it's not regulated. I see them as I drive down all over. So you can go to 5 different stores and get a vaping product, and there might be 5 different concoctions in what's in it that you're actually inhaling or that you're burning. And so,
Mm.
unfortunately, there's a lack of regulation. And then there's also, as I said, an increased amount of exposure from a very young age. I know kids who are 10, 11 years old who are vaping, and they vape a lot. And they vape during school, after school, on weekends, and social gatherings. And that can lead to acute problems where your lungs, in essence, shut down or become diffusely inflamed. And they can also lead to long-term problems like stiffness of the lungs, interstitial
Mhm.
fibrosis, it's called. And then, of course, cancer.
Sorry, what fibrosis? I'm gonna write this down.
Interstitial
Inner.
fibrosis.
Okay. Okay, so a lot of lung specific things, and since we're talking about lungs, I want to also talk about like because I'm a student athlete and I think there are many, if not all, most teenagers that do sports out there. And people say, oh, they give different breathing techniques like box breathing and stuff like that. Do do those kind of like different breathing techniques actually benefit us in any way or
Yeah, absolutely. A lot of those, and I did a lot of mountain climbing in a
mm,
former life. And a lot of those quote unquote breathing techniques that you're talking about change the mechanics of the chest potentially and change the amount of oxygen that you may get in, the actual tidal volume, the air that you're taking in. And so they absolutely make sense. And then a lot of it also has to do with the way you can breathe when you're fatigued. Some of it is just concentrating on focusing when you're fatigued and
mhm.
not falling susceptible to shallow breaths, which of course will, hurt your performance. So yeah, those definitely can make a difference.
How does shallow breath affect your performance?
Well, you can imagine that, especially if it's a long race. Let's say you're a track runner or a cross country runner and you're taking shallow breaths, that probably decreases the amount of oxygen that you have in and probably decreases your not only oxygen saturation, but then delivery to different organs. Maybe it makes you more likely to your muscles not to perform as well. Maybe you get fatigued more easily,
Mhm.
don't run as quickly.
And then speaking of, since we're talking about athletics and performance and things like that, um, you also said that since you're specifically working on thoracics, but you still have a background in cardiac surgery
Everyone
and
has to be board certified in this country in cardiothoracic surgery, even if they
okay.
practice just one or the other.
Okay. So then, since we're talking about that, I know a lot. I wouldn't say a lot of my friends, but there's many people in our community, who are like obsessed with health and being muscular or toned and lean, and they're like, oh, we need a lot of caffeine. So especially a lot of girls and boys in our school and vending machines, they get like Alani's, Monsters, Red Bulls, pre-workout, and like there's also mindsets of like, oh, I'm gonna train every single day, no days off, and like, have you seen side effects of like people actually getting into these kind of things, and like, have you ever gone through a case?
So I guess I wouldn't say that I've ever operated on someone because of caffeine toxicity or caffeine overdose. I've heard of people dying. I've heard of kids dying because of caffeine overdose. And the idea that increased levels of caffeine increase your exercise regimen probably doesn't make sense. Now, if it wakes you up and allows you to get to the gym because you're tired, I suppose that's indirectly helping. But no, the actual benefit in muscle mass because of caffeine, no, that's just, it tastes good. It has a lot of caffeine in it. It gives you the jump. It's heavily marketed. And so you're right. I see a lot of young people taking in 200, 300, 400, 500 milligrams of caffeine per day, which is probably not healthy for a lot of reasons. And then you asked a question about working out every day. Yeah, certainly working out. I work out about 6 times a week myself, working out frequently. I think if you do it the correct way, Now, of course, you could overstrain yourself if you're doing a lot of lifting or a lot of high exertional activities. So you just have to cross train, decide what muscle group you're going to work, etc. Get
Okay.
cardio with it.
Mhm. So I was also like I was doing some research before I interviewed you, like looking at some basic surgeries or common surgeries that thoracic surgeons do, and I saw a lot of lobectomies and pneumectomies. So could you elaborate a little, like, why do you perform those common surgeries, and what are the risks of those surgeries?
So a lobectomy, there are five lobes in the lung. The left side has two, right side has three. If a patient has a lung cancer, let's say in one of the lobes of the lung, quite often the curative lung cancer surgery is a lobectomy. Now you can do a sublobar, meaning you take out less than the entire lobe. That depends on the size, location. There's some other factors, maybe past the beyond the point of this discussion. Pneumonectomy is taking out an entire lung. And sometimes some patients with very large cancers or cancers in a particular central location need a pneumonectomy because that's the only technique and the only surgery that would be able to remove 100% of the cancer.
Okay. So then do they just live with one lung, or
Yeah,
do
exactly. Yeah, when after a pneumonectomy. And so you have to preoperatively measure their lung function, make sure that you think they could tolerate living on just one lung, make sure that the cancer is technically resectable and it's not too central, and some other things as well in part of the preoperative workup.
okay. And since we were talking about like surgeries, what's the hardest surgery you've ever done that like doesn't have to be super high stake or super risky, but like just to you, what was the hardest surgery you've ever done?
Yeah, I'd have to think about that. I'd say the longest surgery I ever did as an attending on my own was, I think, 14 hours. I think that was a reoperative. I forgot. In fact, it was such a long time ago. I think it was a reoperative lung surgery and just
Mm,
very technically difficult. The patient did fine, but it took 14 hours.
mm,
We do a lot of technically very difficult surgeries. And unfortunately, you can imagine smoking, vaping. The majority of our patients have that, and that just makes adhesions, inflammation, the dissection, being able to get to the appropriate structures that you want, all very difficult. So I say a lot of our surgeries are very technically difficult anyway, but that's probably the longest I can think of.
So for students, so like what I'm getting is a lot of surgeons, since they do long term like long hours of standing in one place. um what kind of advice or what kind of traits do you see in people that are surgeons, or what advice would you give to anyone who's interested in medicine or surgery specifically?
So that's one of the reasons I do the Saturday high or the high school mentorship is that a lot of your generation has been using electronics and have pretty good hand-eye coordination, good spatial awareness and dexterity, good ability to use both hands. And so a lot of your generation can do minimally invasive surgery. That's almost all the surgery I do. And a lot of you should be able to do that pretty well. So I would say your generation is predisposed to become surgeons if you're interested. Now, for your generation, I don't think the technical dexterity or the technical ability will be the biggest issue. But to your point, discipline and having a system. So being able to every time research the case ahead of time, know exactly why you're operating, what you're going to do if scenario A happens intraoperatively, scenario B. So preparation, and that takes
Preparation.
discipline, time management, because the
Mhm,
training is difficult. Undergraduate can be difficult, medical school can be more difficult, residency, you're working a
mhm,
lot of hours, more hours than you've probably ever worked in your life. And so having that discipline and time management and being able to do that. And then also, I think getting into it for the right reasons because you want to help patients. I think if
mm,
you can satisfy those criteria or those ideas, then you should be fine as a doctor, surgeon, etc.
mhm. And I hope that this ends up motivating a bunch of high schoolers, because having such a respectable career is the most people's goals. So to kind of start wrapping it up on a lighter note, we can like talk a little bit more about your career. So patience and like obviously like me myself, I've kind of gone through this, but I always feel nervous before I go to a doctor, like or especially a surgeon, or like before a procedure is like done on me. So like, what's one thing you wish patients would stop Googling before seeing you?
Oh, I don't mind if they Google, and I try to explain. So I think there's a lot, I won't be too controversial. There's a lot of things going around in the ethosphere now and in the world about the utility of some relatively proven practices like vaccines
Mm,
and uh, basic practices, basic medications, antibiotics. And so if we're just going to focus on vaccines, for instance, without getting too controversial, and you've heard the noise as well, uh, I do have a lot of patients who Google vaccines and come to me with some questions about vaccines. And I don't mind the questions, but unfortunately, I think they modify behavior and potentially do the wrong thing based on Google or a popular podcast heard around the world. And that
uh,
podcaster saying, well, think about this. So I would say some of the basic health management tools that have been developed over 100 years that have eliminated some diseases and saved millions of lives.
mm.
Given that track record, I do wish maybe some people would at least maybe Google it, but don't necessarily come into my office fixed with an idea.
Well, obviously that makes a lot more sense. And, thank you so much for your time. For any high schoolers interested again in the Henry Ford, internship, I'll have it linked in the description below.
Great.
And this has been Beating with the Facts. Thank you again for your perspective, and I hope you have a great day.
Great. Thank you.